AMP2.TV presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hi, good evening. Welcome to You and Your Doctor, where we're teaching you how to live a longer and healthier life. I'm Lorena Anderson, your life and energy coach, and it's a pleasure to have you come back with us and join us tonight. We've got a couple more exciting doctors on our air, so I cannot wait to introduce them. But before we do that, we are being presented by AMP2 TV, and also proudly sponsored by All County Healthcare, where patients are the heart of their business. And I've got to tell you, if you want somebody who listens, who's caring, compassionate, and tender, whether it's for yourself or a loved one, please give All County Healthcare a call. Ask for Maddie at 888-717-7170. She's waiting for your call, and she will do anything that you ask in order to help you feel secure and confident in what you might be dealing with at any particular moment. So, we are streaming right now live on Facebook, All County Healthcare Facebook fan page. So welcome all of our Facebook friends. If you have any questions whatsoever, please give us a call, 888-565-1470, or you can also call Maddie as well. And we also are on 1470 AM and 95.3 FM. All of our listeners out there, welcome. Great to have you back. And just in case you can't stay with us for the entire show, you can watch us again on 95.3 FM on Tuesdays at 11 o'clock a.m. and 3 o'clock p.m. because they'll be airing it again. So without any further ado, we happen to have one of the top eye doctors here with us. His name is Dr. Larry Lambert. And we are thrilled to have him speak with us about his specialty and what he brings to the table. And I also have to say, All County Healthcare, because of their sponsorship of this program, we get the top-notch professionals in their field. And with every single one, what I've noticed is amazing bedside manner. Like they really care. And I think that that's critical in this day and age. So, welcome.
Hello.
Hi.
How are you?
Good. How are you?
Good to see you.
Oh, great to have you. Thank you for taking time out of your busy
You're
schedule
welcome.
to be
Thank
here
you.
with us. Mm-hmm. So, Dr. Larry Lambert, tell us a little bit how you, what schools you went to, where you grew up.
I grew up in Philadelphia, PA.
Oh, okay.
My father had optical shops, and I learned how to make glasses when I was young, and I would cut and chip the glass and put them into the frames, and eventually got interested in maybe being the eye doctor. So I went back to school when I was 28, became an optometrist, came out, thought I'd help him with the business, and while I was in school, I got very interested in an area called functional vision or vision therapy, and I'd never heard of it before. And it was working with children with different types of learning problems. One of the internships I did, they actually did training with the Philadelphia Flyers and trained their eyes, the vision as a sense, how to perform better on the field, as a hockey player.
Isn't that interesting? Yeah. Well, that's very cool. So I can tell that your passion was ignited by your father. Is that correct?
Oh, yes.
Okay. Because a lot of times I love to ask the doctors that I have on, where did you find your passion? How did that ignite within you? And it's so interesting because sometimes it's with a family member. Sure. Sometimes it's because they've dealt with a certain situation or problem themselves, and that's what took them into their profession. So it's really very interesting.
Yeah. It was funny because, I went to school because I thought it was going to be part of the family business. We could start he had an optical shop. He did not provide eye exams. And I thought, I'll come back and bring eye exams into the practice. And while I was in school, I started to go to different lectures where they talked about how different lenses could tighten back muscles, loosen back muscles, how lenses and vision actually affected your body and your performance, as opposed to my exposure to make someone see clear on a chart and make sure they don't have a disease. And that's really where my passion ignited, because I hadn't even known about it when I was in my father's business.
That is really, really interesting because, I've heard of two different philosophies. One is that, first of all, no matter who you are, your eyes are going to get bad after age. There's just no two other ways around that. And then the other that I had heard was that if you wear the glasses, you're not strengthening the eyes at all. You're just making sure that you can see better. And then I also was introduced way back when with my youngest daughter. I mean, this must have been, 30 years ago. And they were training her with exercises, how to strengthen the eyes.
Right, that's what I do. Yeah.
Well,
so
isn't
there's
that
a yes
wonderful?
and no to a lot of your observations.
Okay. Clear.
Basically, with the glasses, there are certain ways I prescribe that enhance vision or train vision.
Train vision.
You
Okay.
know, or actually get people to perform better. And the eyes, we can think, well, they're going to get worse as we age, but there's also techniques to bring them down to more youthful levels. University of California proved this, found that with about 12 hours of vision training, perceptual training on computers, the vision got to more youthful levels, whether it was seeing on the chart or whether it was the way you function. Think about your eyes. You look from object to object. You judge the environment. You have depth perception. How is your reaction time? Studies have shown that when you train senior drivers on visual skills on a computer, it reduced their car accidents up to 50% and improved braking distance 22 feet at 55 miles an hour. It was more effective than practicing driving or working with a driver simulation.
I love it.
You know,
Do you
so that's
think
what
we
I
can
do.
sign up a lot of seniors?
Oh, yeah.
Oh,
we'd love
especially
to.
right now. We got the
Yeah.
snowbirds down.
Yeah. And it's about, it was training what's called useful field of view. You know, you can go to the eye doctor and you can test your peripheral vision. You one eye at a time, you see the lights in the machine and you say, oh, I could see all the lights. I have a good peripheral vision test. But it's more, useful field of view is more, do you see things in the periphery and react to them in the real world, like when you're driving?
Yeah.
Did you notice that other car? Did you notice that person? And did you respond to it more quickly? So that's what the training worked on, was what's called useful field of view. You have peripheral vision, but how in touch are you with what's going on in your periphery?
And that's so important because, to be aware of your surroundings. That's one of the things that they,
Right.
are always saying. Please always be aware of your surroundings.
Yeah,
so that
so-
makes really good sense.
Yeah, so a lot of it is not just about seeing letters on a chart. The part of the eye that sees the letters on the chart is very small. When you look at the eye chart and you read those letters, think about, you even have to move your eye from letter to be able to see them. So that part of the eye is very, very small. Peripheral processing is where a lot of the action is, and that it's not just way out here. It starts about here and goes the rest of the way out. And that part of the brain, that part of the eye goes into the brain 25% faster, and 20% goes to balance. So we look at how are we doing and integrating the center vision with the peripheral. And under stress, we tend to tunnel our vision. I work with police, and there's something called body alarm reaction, whereas they may pull a weapon or a weapon is pulled on you, your vision is going to constrict into a tunnel.
Right.
Well, tunnel vision, we've all heard of
Yes,
that, right?
yes.
So when we drive, we can be tunneling our vision and not noticing things off to the side and have more chance of getting into an accident or not avoiding one than we could have if we've trained the peripheral vision how to stay alert and vigilant for us.
That is really interesting. Can we get some more seniors out there?
Sure.
I would love to get our seniors so that, they would have more of the range of motion. And,
Right.
I have glasses, but I don't wear them very often.
Nothing wrong with that.
Well,
Wear them when you need them.
somebody said, where are your glasses? Why don't you wear them? Because I can't see street signs real well at night. But I'm
Right.
like, I can handle it.
Yeah, but you know what? They actually, California showed that tests of peripheral vision reaction time would predict more who would get into an accident than the size of letters seen on a chart. So that chart's been around since before the Civil War to see who could hold a rifle, and it's still considered standard of care, but it doesn't predict performance for us. You know what I mean? So
Yes.
that's what I look at, is how do you perform with your vision? How do you use vision as a sense that gathers information and leads movement? For example, if someone has a stroke, that whole system can be thrown askew. We have what's called midline shifts, where someone will think, oh, that's in front of my nose. That's in front of my nose. And I'll touch the tip of my finger. They come in from the side, or they're missing food on the plate, because this whole system is now misjudging where things are. Where's the doorway?
Wow.
Oh, I always bump in my right shoulder when I go through the doorway, because they're misjudging it. And that's part of this system.
Okay.
This system goes in faster. It's also your navigation system when you walk through doorways, walk down the hallway, or when you drive and you're daydreaming for 5 minutes, you go, how come I don't run off the road? I forgot I was driving. Well, a lot of people that happens to, right? And you're all on this navigation system. So I work a lot with that, especially strokes, concussions, or it's even been found that in seniors, a weakness in the way the eyes hold together as a team is more of a risk factor for a fall than cataracts or macular degeneration. So the skilled nursing facilities I work with, or at FAU, the Falls Prevention Center, we look at how well are the eyes working together as a team? How well do they focus together? And by the age of 60, 43% of the population has a deficit in that area. It's just not discovered during eye exams because they're not looking for it.
They're not looking for it, yes.
You know what I mean? So I can predict, well, not predict, but say like, wow, we have more of a risk factor for fall in this patient or this patient.
So what are some of the tests that you do in order to be able to measure that peripheral?
The peripheral, I'll actually just do confrontation fields. You know, can you see my finger wiggling? See it wiggling, both sides. I've had patients where they can see all four quadrants with each eye, but the two eyes together, I start to do this, they can't see one on one side. Oh. So the machines in the doctor's office are looking at one eye at a time, but what happens when the two eyes have to work?
Exactly.
Remember I told you that center vision, peripheral vision, we have people who shut off the center of one eye. So it affects their depth perception. Right. So it's looking more at these functional issues that I work with, seniors, athletes. I work with professional baseball teams. I work with the SWAT teams. How do we increase function? Faster eye movements, gather more information in less period of time to create a better, observation, orientation, decision, action. How do we speed up that whole loop and make it more accurate?
So say that again, because that's really important, and I really want my listeners to be able to hear this. How you begin to determine their eyesight and whether and the various functions of that eyesight. Share that again with us.
Well, do you mean that observation?
Yes,
where somebody will observe something, they get oriented to the situation, they make a decision, and then you have action. Like if you were a SWAT team operator and I want to do a demonstrator and say, if I put this gun to your forehead, what's going to happen to your vision, which of course is going to collapse, before my hand is there, he's already batted it out of the way and his other fist is in my face.
Okay.
So he's trained to do that, right? So that's a very fast loop. And if we can take 1/10 of a second off that loop, or baseball players, think about being at bat. You have 4/10 of a second for a pitch.
I got to tell you, 90 miles an hour, that ball's coming at you.
Right. So they have the circuitry developed in the brain.
Wow.
Right? And the scientists will tell you it's impossible to hit a baseball because it takes 7/10 of a second for all those circuits to fire. Yet they can hit a baseball that takes 4/10 of a second and make the decision in 2/10 of a second because the wiring has been developed. These same baseball players, including Ted Williams, will be struck out by a softball pitcher because they don't have the wiring.
Right.
So when we get to the vision training aspect of what I do, whether it's for sports team, police work, or in seniors to reduce falls, it's about creating the wiring to be more effective. You know what I mean? And basically, I call it training instinctive reflexes. Think about the heat of the moment, getting out of a car accident or anything, or hitting a baseball even, is on a reflexive level, vision to body.
Right,
vision the brain, the body. It's reflexive, very quick. So is, maybe recovering and not having a fall. Not a lot of thought involved in that. So can we tune up those whole processes that are going on from vision to body? It's part of the work I do in the rehab hospitals, professional ball teams, SWAT teams. It's just all about improving visual function.
That is really important, and it's so amazing to me that there are so many other factors that play into it other than just a pair of glasses.
Right, because most people, again, we grow up and we think and we learn. Eye cares about making letters on the chart clear.
Right.
And do you have glaucoma or not?
Yes.
And that's about what most eye doctors are looking for.
Yeah, it's the 20/20.
Right, exactly.
Is it just 20/20
exactly.
vision?
Like I said, it's from the Civil War. The people who do what I do, we're more concerned about how you function with your vision. Can we prevent a fall? Can we keep you out of an accident? If you've had a stroke or a concussion, most doctors you go to will say, well, you have a visual field loss or you have this problem or that. Come back in 6 months and we'll look at it again. And they don't offer interventions.
Exactly.
And what I do is more like occupational therapy for the eyes.
Okay. Okay,
You know what I
great.
mean?
Yes.
And I work with occupational therapists that go into the home or work in facilities. What can we add to the therapies we're doing to create better outcomes?
Right.
More
to work on that wiring.
Right, work on that wiring.
Yes.
Yeah.
Well, I just want to take a second here and say I wanted to thank All County Healthcare for sponsoring this evening's show and all the rest of the shows that they've sponsored, because we get to learn about so many different aspects of healthcare because of them. And, that's what caring for your patients really means. They want to be there for you. They want to help you in whatever manner they can. And that's one of the reasons why they have this show. And we've been on 7-8 months now. Mm-hmm. And you can find us here on Tuesdays between 6 and 7 every week without fail. So, thank you, All County Healthcare, for sponsoring this. Thank you, Dr. Larry Lambert, for being here and educating us. It's fascinating what you're talking about, and how important is it? And this is for my listeners. How important is it to be able to function with your eyesight, not just have the glasses? I mean, I remember when I used to put on glasses, and I felt like this duck almost,
Right.
constantly like this. Like I had to turn my whole head to be able to see anything.
Were you nearsighted?
Yes.
Right. Some of the lenses that are thicker will tend to tunnel your vision, pull you into the center system.
Okay.
And we actually have 2 gold medal Olympic athletes that when they were made super clear, it slowed down their performance because it took them out of that peripheral processing, which is how they were navigating through the gates skiing or piloting a bobsled, and put them into that center vision, which just took their attention away from what they had to do.
Right,
So
right.
it's interesting. It's not always the best thing
interesting
to have the clearest prescription. It can detract from the periphery, which is it did in your case.
Yes, it did.
That's what you were experiencing.
I like that. Thank you.
You're welcome.
So, talk to me about some of the things, the techniques that you use then to strengthen the eyes, to strengthen the periphery, so that you're more functional.
Right. There's techniques that have always been around, and I've developed computer programs to do this. I have a computer program called iPerformance, iPerformance.com. Some of the therapy centers will use that, where I have peripheral vision activities for what's called saccadic eye movements, which is if I look from you to the audience back to you, my eyes make a jump, and they have to accurately land there, right? When you read, think about what your eyes do. They make very precise jumps. Do you know what I mean? They don't just scan across the page. And these jumps, if they're not precise and right, you skip words or you skip lines or you don't get back to the right line.
Right.
So part of the
or you
elements,
sit there and read over and over and over again.
You read over and over again.
The same.
Or you put in so much energy to do this, you can't remember what you read. Right?
Yeah.
So much navigating. So I have programs that work with those skills to make those more accurate, easier for the system to do.
Oh, very cool.
I work on zone training even with the athletes who will tell you, sometimes the ball's bigger moving slower and sometimes it's like a BB whizzing by me. That's how they're integrating their central peripheral vision. So I train them, what is the access to that zone? When I work in rehab, we could have somebody with what's called a blind field. I don't see anything to the left or I don't see anything to the right. So I have techniques to train them, first of all, to scan and look to that side, make sure it exists. You don't want to cross the street and not check to the left because you don't see to the left. So tracking and scanning into it. Then we have blind field stimulation procedures where we stimulate that area of vision, through different techniques. Can we bring back a visual field? Do you know what I mean? That's missing or gone. And a lot of people with a visual field loss, they have, let's say their vision's like this. It used to be like this, right? Now their vision's like this. Their sense of center goes over to the side.
Yes,
so I work with what's called yoked prisms, which is a special way of working with prism to draw that midline back to the center. So all of a sudden, like they think they're standing up straight, you're pushing me over, the prism's on, now they stand up straight. Now they go through the center of the doorway. Their balance gets better because we're prescribing now for the peripheral processing instead of the letters on the chart. So those are some of the tools we
I
use.
totally understand that because when I was younger, in high school, one of my boyfriends, his dad was an eye doctor.
Okay.
And he worked with prisms.
Right.
And that's what my mom had. My mom had prism glasses as well. Wow, that's
Sometimes
very
we
cool.
work the prisms for double vision. You know, if you see two of me, I'll bring one image down, one image up. And sometimes we put them both up, down, left, or right to work with your sense of spatial. You know, where are things? Where am I in relationship?
Yes, yes.
I have some children that'll walk up and, you know, there's, say, a line, the carpet to the tile, and they stop because they're not sure, is that a step up? Is that a step down? I'm afraid of that border.
Yeah,
and we'll work with these prisms, and all of a sudden they become more sure on their feet.
Very
because
interesting,
we're working
yes.
with the center, the peripheral integration for those spatial relationships.
So that does not work well, or does it work well with, say, LASIK? You know, when somebody goes in and has LASIK surgery, you still then have to correct based on with the prisms and everything for them to be able to see it?
You know, LASIK corrects you the same as glasses.
Okay.
Just plain, but they don't do LASIK to create prism.
Right.
So if you need prism in your glasses, you're probably not a good candidate for LASIK because you might see double, right?
Yeah.
Yeah. So I've had people that have LASIK, and you know, if they've had strokes or concussions.
Oh, yes.
Do you know what I mean? Then we'll work with these type of prisms in glasses, but maybe no nearsighted or farsighted prescription.
So with the strokes, that's the lack of the blood flow going into the eyes?
Well, in the brain.
Okay.
You know, so people will say like, oh, I don't see anything to the right or to the left because they've had, you know, a right injury or a left injury that affects one side of both eyes. And they don't realize. They come into me and say, oh, I can't see with my right eye. And it's like, well, they see, but they can't see anything to the right with the right eye or with the left eye.
I see.
So
Gotcha.
that's a blind field or visual field loss, hemianopsia.
So, and the same thing then with concussions as well?
Concussions will have a little bit of different presentation. The most common is convergence insufficiency, a difficulty in holding the eyes together as a team.
Oh, okay.
So some of them can do it, but they have a harder time doing it. So it affects reading, of course, sports performance, driving safety. Another thing with concussions, remember we talked about this peripheral processing.
Right.
The system becomes hypervigilant, or it notices too much, so that we have some people with concussions that walk down the aisle in the supermarket and they can't do it because all the cans and things on the shelf are just driving them crazy, or they can't go in a
Overstimulation.
moving car. Overstimulation of this
gotcha.
system, which most of the time is kind of, I don't say asleep on us, but it's quiet. And if something where someone threw a ball at you, you might wake it up and put your hand up to block the ball.
Exactly.
So this system will become vigilant like that all the time.
Oh,
And
goodness.
it's very bothersome.
Yeah.
You know, so sometimes we'll work with what's called binasal occlusion, where I run tape glasses here. So now only the right eye has to handle the right field instead of the right and the left eye seeing over there. Oh, just the right eye has to see over there now. Just the left eye has to see over there. Sometimes that'll calm it down.
I
You know,
see.
even the
very
U.S.
cool.
Army has gotten wise to this because for many years the guys were coming back from overseas with concussions, and they would tell them, oh, there's nothing wrong. You know, your eyeball's healthy. There's nothing wrong with your vision. And there was. The convergence problems, the peripheral problems. So now Walter Reed and 4 other Army hospitals have set up these centers, these centers of excellence to treat these soldiers. And they're all optometric specialties. The ophthalmologists don't generally have a clue about this stuff. It's all optometry clinics where they're more functional in nature.
Okay. Well, you know, tell our audience how they can get a hold of you.
I have an office, West Boca Raton.
This is so good.
441 in Yamato, 561-479-1411, 561-479-1411. I have a website, drlambert.com, so you can learn about me on my website and the different areas of specialty, which are, you know, children with learning problems, the senior population, falls prevention, concussion,
Stroke.
rehabilitation, stroke, vision rehabilitation, and falls prevention, which is a big area.
Yes, it is.
Yeah.
Absolutely. From, you know, we've had other doctors on, and that's one of the things that, you know, has been a real difficulty.
Sure.
You know, and lighting, so that,
Right, lighting, yeah.
you know, the seniors can see where they're going. Rugs on the floor or cords on the floor.
And there's a big push now in skilled nursing facilities where they look at like the type of carpeting and the lighting, and it was done by interior designers, not people who knew function. You know, where you have a crazy pattern on a carpet and it drives people's vision kind of nuts, where they'd be better off with a solid color and maybe borders down the side to use as a guide.
Yes.
And the type of lighting. I have a lot of experience in low vision. I worked in the Fine Bloom Low Vision Center in Philadelphia, and he developed all these lenses on 60 Minutes with the telescopes and all that.
We had a doctor on, and he brought his glasses, and they had the lenses on, and it was unbelievable. It was amazing.
And what was interesting to me is like they'd wait 6 months to get in there. They would come from overseas across the globe, and many of them went home with a gooseneck lamp. So some people had trouble reading. It was just, shine a light, a little 60-watt regular old bulb. But that you can aim at it, improve the reading significantly for a lot of people. So lighting's important.
That's all I need is lighting. I'm sitting in the restaurant. I'm like, okay,
I know, so we take out our phones.
Yeah, where's my phone?
Menu.
I need my lighting.
Yeah.
So, well, I can't thank you enough for being with us tonight. And again, if you have any questions for the doctor, even if he's not here, or if maybe tomorrow or the day after you end up seeing the show or hearing about the show, you can always call All County Healthcare at 888-717-7170. Ask for Maddie. She will answer any questions that you might have. And if you need to get a hold of one of the doctors, she has all their information. So before we go to commercial, please tell our audience again how to get a hold of you.
Again, West Boca Raton, private practice, 561-479-1411, or you can go to my website, drlampert, lampert.com, and find out my address there and kind of read up on some of the work I do.
Yeah, excellent. Absolutely. Absolutely. So we're going to be back in a moment. We're going to take a little commercial break here, and stay tuned. We have Dr. Lisa Learn, who's coming in, our plastic surgeon, and she's got a lot of information for us. So come on back.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Hi, I'm Deanna Barron, RN, with All County Healthcare. You know how I know that I've done a good job? We say goodbye. After you understand the medications you take, once you know that gaining 2 pounds in a day means you should call the doctor, when your wound is healed, when you can use your nebulizer all by yourself, when the goals that you and your All County Healthcare team of nurses, therapists, and aides established are met. We say goodbye. Very nice to meet you, and I hope I never see you again. And I mean that in the nicest way possible.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hi, welcome back. I'm Lorena Anderson, your life and energy coach, and you're here on the show, You and Your Doctor, where we teach you how to live a longer and healthier life. We're being presented by AMP2 TV and sponsored by All County Healthcare, where patients are the heart of their business. So I'm very, very excited to have our next doctor on, Dr. Lisa Learn, and she's a plastic surgeon who has also come from Philly. Our last doctor, our eye doctor, came from Philly as well. So we've got some very exciting news to share with the audience. And if you have any questions whatsoever for Dr. Learn, you can call in at 888-565-1470. Or if you didn't get that telephone number down, you can also call Maddie at All County Healthcare at 888-717-7170. She would love to answer any of your questions. So without any further ado, I'd like to introduce Dr. Lisa Learn to our show.
Hi, how are
Hi,
you?
good. How are you? It is
Very
great
good.
to have you.
Thank you. Nice to be here.
So we just found out that the last doctor also came from Philly, which is very, very interesting. We've got the Philly contingent going.
Yeah, the Northeast section.
Yes,
Yeah,
yes.
yeah.
And as a matter of fact, they're getting hit with a crazy storm right now, too.
I'm glad we're here.
Yeah, well, we're just trying to get out. So tell us a little bit about yourself, where you came from. What created this passion of being a doctor? Was it somebody in your family or something that you were working with?
Well, I grew up in a family of nurses, so I had the medical background, and I had every intention of going into nursing, and I had gone to college with the hopes of, getting into nursing school. And in fact, my sister-in-law pulled me aside, and she says, "Lisa, I don't mean this in a bad way." But
And then you're holding onto the chair going,
I'm like, oh.
okay, here it comes.
Well, yeah, what are you going to say? She says, "I think you should go to medical school." And I'm like, "Well, why is that a bad thing?" And she says, "Well, because I think you'd be more apt to be able to give the orders than to take the orders." I mean, so I'm a bossy person. I don't know, but
Strong, demanding,
strong
woman,
independent woman.
I
maybe.
like that.
Yeah. But anyway, so I thought, why not? Why can't I go to medical school?
Yeah.
So I ended up going to medical school. I had so many different specialties that I wanted to do: sports medicine, GYN. Delivering babies seemed so romantic to me, so cool to me. Bringing life into the world, and until I started doing the long hours, and then I decided that was not for me. But when I was on a plastic surgery rotation, I watched this doctor recreate a breast. This lady had a back, neck, and shoulder pain from large breasts. She was a triple D.
Oh my
She had
goodness.
grooving in her shoulders. It was visible. And he took her to a beautiful C cup. And I'm, while he's working, I'm thinking, how on earth is this going to come together? And just like that, it was the most beautiful creation. I said, that's what I have to do. I like
That's
the creative
so
part of it.
Amazing.
Yep.
And you know something, I do have to commend you or at least acknowledge you. You are an amazing artist. I've
you.
seen some of your work. And it is spectacular.
Thank you.
Really spectacular. And, it's so necessary. It really is because, God, we're created with all sorts of wonderful situations that sometimes aren't always in our favor. Right. And I have, as I said before, I've seen some of your work and how astounding it is. I mean, it's remarkable. You are
Thank you.
really an artist.
I love what I do.
Yes,
Absolutely
I know.
love what I do.
Yes, and it shows.
Thank you.
It shows. So, where did the word plastic surgery come from anyhow? Because everybody thinks that because it's plastic surgery, it's because there's pieces of plastic that are put into you.
Exactly. So I've had patients ask me, so when do you put the plastic in? Actually, plastic surgery comes from the Greek word plastikos, which means to mold or shape. So that's what a plastic surgeon does, is molds and shapes the soft tissue.
Oh, okay.
Yeah.
Okay. Well, that's very cool.
Interesting.
It is because it can get kind of distorted. The understanding of the terminology can get a tad
Yeah.
distorted.
Yes.
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 Tell us a little bit more about reconstructive surgery because being the fact that I not only know you personally, but I've also seen your work as well, and how absolutely important it is in the reconstruction phase for mainly women. And in case they've had, breast surgery, breast cancer, share with us that piece of your specialty.
Plastic surgery, believe it or not, is an integral part of the whole process of the mastectomy, the breast cancer experience. And more and more general surgeons are making sure that they offer this option to their patient. first and foremost because psychologically, to come out of surgery having had a mastectomy, feeling like they've lost their femininity, and waking up with the start of their breast reconstruction. So they don't have that sense of loss or mourning for what they've lost right after surgery. So the biggest benefit to plastic surgery after something such as, cancer, as far as the reconstructive process, is psychological. And then, of course, structurally, it gives them back what they had before, and is probably one of the most gratifying surgeries I do.
Really?
Yeah. It's so nice to, I've had patients who have been so grateful in my office weeping and, telling me that I've given them back their life. And it's very, very, it's very nice to hear that, and to know that you could help.
Well, you do make a huge impact on people. Your bedside manner is amazing.
Oh, thank you.
Yeah, absolutely. Absolutely. I mean, let our audience know how to get a hold of you.
Well, actually, we are moving to a new office.
Oh, my gosh.
So we are currently on West Oakland, but we are now moving to a new office. It's at 3536 North Federal Highway, Suite 100, in Fort Lauderdale. So it's on Federal Highway between Commercial and Oakland Park. So a lot easier for our East Side patients to get to.
Yes.
So,
it's right next to the Leather Express, just in case you need to know.
yeah, exactly.
Yes, that's exciting. And when are
Very
you moving
exciting.
in?
April 1st.
Yay.
And it's not an April Fool's joke.
Yeah, you can. Are you going to be ready? Oh, just kidding.
Yes.
Good. Oh, that's wonderful. That is great.
Yeah.
I
Happy to be there. And our phone number is 954-380-8411.
Okay, great. Excellent. So if you have any questions at all for Dr. Learn this evening, you can call 888-565-1470. And our phones are open. Give us a call. So let's talk about as we begin to age. Everybody's into anti-aging formulas, anti-aging fillers, anti-aging, you name it, breast augmentation, tummy tucks, liposuction. Give us a little bit of information about that.
Yeah, you've named it all.
Almost all
of it. Yeah. Well, I think as we get older, and I, of course, have experienced this firsthand. We may be in our 40s, but we feel like we're still in our 20s, and so people want to reclaim, the youth. They want to reclaim how they felt. They said, they feel wonderful. They're like, I want to look as good as I feel.
Yes.
And, so a lot of people come into the office and they say, I feel guilty for having plastic surgery because I feel it's vain. And I just tell them, you get up in the morning and you brush your teeth so that your breath doesn't stink.
Yes.
You comb your hair so that you're presentable. So
and you put on makeup.
And you put on makeup. So,
Yes.
These are things that we do to improve our self-esteem. And they're not necessarily for other people. They're for us.
Right.
So doing these anti-aging things are for us, unfortunately, that's when I have to turn patients away, is when they're not doing it for themselves. If they're doing it for their husband, to try to save their marriage, they're doing it for the wrong reasons, or they're doing it for someone else.
Or they're addicted to it.
Absolutely.
Because I've seen that happen as well. There's been a couple of my clients also that just continually go in and go in and go in. And it's like, wait, stop.
There is such a thing as too much.
Oh, there is. And you can see it, though, and it's very unfortunate that an individual would go through something like that. I mean, we've seen all the horror stories on TV and the commercials.
Botched.
Yeah, totally botched. And that, brings up a really good segue as well, though, because you work on a lot of patients that have had botched surgeries.
Yeah. Patients will go sometimes and look for the best deal, and they don't look for the best surgeon, which is unfortunate. And, I tell patients, if you're going to have a procedure done, 1, make sure your surgeon is board certified. 2, ask them how many they've done, and 3, make sure that you're able to talk to your surgeon. If your plastic surgeon just dismisses you and just says what they need to say and leaves the room, then they're not going to be the best plastic surgeon for you.
You're right. Because they're not listening.
But then again, you want a plastic surgeon,
Right.
in this economy, a lot of other fields are getting into plastic surgery because it's, self-pay for cosmetic surgeries. And
Right,
so,
right.
unfortunately, sometimes you'll have people who haven't been trained properly on a procedure doing something.
Let's go to the dentist for a little Botox.
Well, and again, I say properly trained. If someone has years of experience, that's great.
Yes, yes.
But just make sure the person you're going to knows what they're doing.
Yeah, and let me just say, there's a real big difference, okay, with someone who is schooled in plastic surgery, in the face, and how to apply the proper injections and where to put the injections, versus somebody that usually puts the injections in the mouth and numbs your teeth to work on them.
Well, the plastic surgeon too. We've been through
Yes.
these surgeries. We know the muscles that we are hitting. We know the vessels to avoid. We've seen them.
Yes.
Yes. in surgery. So we kind of know a little bit what we're doing.
Yes. And remember, this is your face. I mean, you don't want to end up with any kind of complications or distortions.
And you want somebody who knows what to do with the complications
Yes.
if they happen.
Yes.
Yeah.
So, and I know that, you've worked with quite a few individuals that have decided to go the cheaper route and not, taking a good, they didn't do their research. And unfortunately, they've dealt with the consequences. Fortunately, they found you.
You get what you pay for.
Yeah. Yes, you do. Yes. But I mean, I have personally seen some individuals that are coming into your office and crying because they're so happy finally somebody has listened to them, somebody has helped them, and they get to have their breast back again. I mean, it's been unbelievable to personally experience that. The psychological piece here, I just really want to bring that up. You're right. This isn't done in vain. This is done so that you can feel so you can look as young as you feel. Because, everybody's laughing. Oh, yeah, 60 is the new 40. Well, I've got to tell you, I feel pretty 40. And I'm going to be 62 at the end of the month, right?
Right.
So, but I'm feeling pretty 40.
Yeah.
And I want to look that good as well.
Well, you do.
Oh, well, thank you. That's because of you. And it feels refreshing. It feels alive. And the other thing that's really important too is that, especially for females, males as well, but we want to feel that beauty, that natural, youthful beauty that we had when we were younger. I mean, it's good for your self-esteem. It's good for your self-confidence. And not only that, it's really good for your sexual life as well. Because when you're feeling good and you're feeling healthy and you got a little bit of a twist in your body and your face is looking good, you also end up feeling more sexual. And that is really important for relationships, is to have that connection, that sexual connection.
And psychological well-being.
Absolutely. Absolutely.
Yes.
And that's what grows those relationships.
Yes.
So it gives you all the various elements of a very healthy lifestyle.
Exactly.
So what are some of the other things? I know you do the reconstruction of the breasts. You also work with botched surgeries. I hate to say that, but thank God you're there. You work with breast augmentation as well.
Correct. Yep.
Okay. And then what, tummy tucks you were talking about as well?
Tummy tucks. We do tummy tucks, especially, for the moms that have had their children, and children are great, but let's face it, sometimes they suck the life out of you. Things droop afterward that shouldn't be drooping.
Yes.
So I just, a little pick me up is nice after, you've done the time, with birthing the children.
Yes.
And dealing with the things that sag. Yeah. And it's nice. It's nice to be able to offer that. So tummy tucks, breast lifts, breast augmentation, breast reduction, but also facial work, So as you get into your 40s and so, everybody's in the mirror tugging and pulling and lifting, and if I only could get rid of the sag, right? So,
Yeah, a little bit.
so a little pick me up there is nice too. Eyelids, face lifts, neck lifts,
And you do all of that as well, huh?
I do.
Wow.
Absolutely.
It's and again, I've had the opportunity of seeing your work, and it is astounding. How do they find, I want them to get on your website so that they can see the differences.
Sure.
Because you've got, some pictures and everything, before and afters.
Yeah, I have some before and afters.
Okay.
And my website is drlisalearn.com. DrLisalearn.com. Not learner, not learned.
Just learn.
Dr. Learn.
Okay. Yeah, because you've got some great pictures up there and everything.
Yeah, we have a few. We're going to be adding more. We're actually going to be going through a website redesign soon. So we will have a lot more coming.
Well, that's wonderful, because we'll match your new office.
Yes.
Oh my gosh, I'm thrilled to hear that.
Thank you.
And give us the address again.
It's 3536 North Federal Highway, Suite 100, Fort Lauderdale, Florida 33308. And the phone number is 954-380-8411.
Excellent. I'm so excited for this new move, because I know that you've been over in Oakland Park for, what is it now, 5 years?
4 years. 4 years.
4
Yeah.
years.
Great location, but a little hard for people to travel to.
Yeah.
The east-west travel gets a little tough sometimes. So,
Yes.
yeah, it'll be a little bit more convenient for my east side patients.
Oh, they'll be so excited. Me too.
And it's only 5 minutes from my house, which makes it even better.
Oh,
Yeah.
nice.
Yeah.
Nice. So, what I'd like to do, I'd like to talk a little bit about some of the facial injectables that you offer, and what the various what they do, what their differences are.
Sure. There are two, I'll talk about fillers and neuromodulators. Okay. Most people come in and they're not sure which one they need.
Okay.
Neuromodulators are things like Botox, Dysport, and Xeomin. Okay. Those things paralyze the muscle that causes the wrinkles that you see. So the lines across your forehead, the crow's feet around your eyes, the 11s between your eyebrows. So
I had 111.
some people have 111.
That was me.
That was you. So Botox, Xeomin, Dysport, they paralyze the muscle for 3 to 4 months.
Okay.
So that those wrinkles don't get ingrained into your skin. So the best time to start a neuromodulator is when you start to see those wrinkles, because then you can prevent them from getting ingrained or furrowed into your skin, which would mean if they do get ingrained or furrowed into your skin, you would also need a filler. So the fillers are Juvederm, Voluma, Volbella, Restylane, Radius. We have Sculptra is actually not a filler. It's a different product, but it kind of fills in where you need it to fill in. But those are the ones we use, and they are all very good, and they all have their own little niche or specific area where we use them. We use Volbella is a new one for the lips that is just beautiful. Oh, so easy to use, instant gratification, beautiful results.
Yes.
And it can be used. It can be used in the marionette lines. It can be used in the nasolabial lines, which are the lines that go down to the corners of your mouth.
Okay.
So, yeah. Now, Sculptra is an entirely different thing. It is and not a filler. I tell my patients that a filler is like putting caulk in a crack. You're filling it. Okay.
Right.
Sculptra actually uses your own cells to develop fullness. So as people age, you develop kind of a gaunt look sometimes, sunken in cheeks.
Yes.
Yeah. We lose these beautiful, youthful apples of our cheeks, and all kinds of sags, and it ends up down here. But Sculptra will help to recreate some of that for us. And it uses your own cells. So it's not an artificial material sitting there taking up space.
Oh, okay.
It's your cells that cause the reaction.
That's very interesting. And how long does that last?
Sculptra lasts anywhere from 1 to 3 years.
Wow. So that's well worth the money then.
It is.
Okay.
It is.
And the fillers, how long do they last?
8 to 12.
Okay.
Yeah. We found some people are different. Some people metabolize some fillers quicker than others. So we may have to, if we notice that that's happening, we may have to switch. But, we hope that, that it's better for them. But people with fast metabolism sometimes do, get rid of them sooner.
Okay, great. Now, I want to kind of dispel a myth.
Absolutely.
Something that I have heard for, 4 or 5 years when Botox first came out. And they said that they called it rat poison and that you were putting rat poison into your face. And I think that really scared off a lot of people thinking that, they're putting some sort of poison, into their face. So tell me about that.
Well, Botox is in Dysport and Xeomin or botulism toxin. I think that's where they get the idea of poison.
Yeah.
But what you're doing is you're injecting a very controlled amount of neuromodulator. It does not go to the rest of the system. It stays where it's injected and does its activity on the muscle that it's intended for. So it's not a toxin that's circulating throughout your whole body. But it does actually work in paralyzing the muscle for a brief period of time.
Thank you very much. I really appreciate you saying that. Because I had heard it, and some people are still under the assumption. I'm surprised that they haven't been educated. So I appreciate that you have educated us on that particular issue.
Sure.
And then the other thing that I'd like to find out about, because sometimes we see that somebody's got so much filler in their lips, and it's also again can scare some people, from
the
getting
best,
that
the best
taken care
plastic surgery or the best injectable is one that's natural. We want to enhance what you have, not give you something, that's out of proportion to what you need.
I think they called it duck bills.
Yeah, duck lips. So there are absolutely certain techniques that you can employ for injecting fillers so that you don't end up with that look. And you do have to, as a plastic surgeon, just say no.
Yeah.
Yes. I tell my patients, you are my billboard. And I will
like
not,
that. I like that.
And I want a nice billboard.
Yeah.
That looks natural. I mean, that's our MO at the office, is a natural look.
Yeah.
I don't want to send anybody out with anything that I wouldn't do myself. And for the most part, I've tested just about everything out on myself, so I know how it works and how it looks. I wouldn't do anything to my patients that I wouldn't do for myself or a family member. So.
Well, that
Yeah.
I appreciate that. But that goes back to you being an artist and what you do. And that's what's so impressive. I was telling you at some other point as well that it doesn't matter whether or not the patient's awake or unconscious, under the knife, that you have the same level of expertise, professionalism, and artistic ability, whether someone is awake or asleep. And that for me, is a very comforting feeling. To know that I'm in such good hands that I have no cares whatsoever, and that, when I do wake up and recover, that everything's, exactly what you had said it was going to be. So I want to commend you on that.
Thank you.
Absolutely. Absolutely.
Yeah, I've been told I have a soft touch. So having had these injectables myself, and most of them have been self-administered, I know how badly they hurt. So I will do everything in my power to make it less so for patients, especially if they're awake.
Yes, yes. So give me some other ideas as to what else is being done. Like I've heard of some of the butt lifts that are happening. I have heard, I know about the tummy tucks and the lipo. What else have they been concentrating on?
Well, fat grafting is very big. You're taking fat cells from other parts of the body and putting them into an area that you would like to enhance, like the buttock area. They've even done fat grafting for the breast. They also take fat grafting to fill in for the face. And it's very nice. It's a very nice result. There are some risks and complications that can occur, and if you decide to do something like that, your surgeon would go over that with you. You might need to be prepared for more than one procedure to get it even, because the fat does not have its own blood supply. When it's inserted into the area, it's relying on the surrounding blood supply. So you have to be wary of things like getting a 20% take on one side and a 50% take on the other, and then having to go back and add more. But as long as a patient is aware of that risk, and the concern, then they would be a good candidate for possibly having fat grafting.
Very interesting.
Yeah.
Well, thank you for that.
Yeah.
I really appreciate you coming in tonight, because I do know how busy you are. And you have been, one of the stars in my life. And I love sharing you with everyone.
Thank you.
And if you have any questions whatsoever for Dr. Learn, you can call Maddie at All County Healthcare at 888-717-7170. And I want to thank you because of you, a lot of women out there are feeling so much better about themselves, healthier, they're laughing more, they're alive, they're youthful. And so thank you very much.
Thank you for having me.
It's my pleasure. And you can find us here every Tuesday between the hours of 6 and 7, and where we end up speaking with other doctors on their expertise and their professionalism, so that we can help educate you, so that you have insight as to what you might need personally or a loved one might need. So thanks so much for joining us tonight. I'm Lorena Anderson. We'll see you next week.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of the state